You know, strokes affect millions of Americans, and when it happens, it can be fatal, obviously, but devastating to survivors oftentimes. The killer can often go undetected. Dr. Warren Levy is going to tell us about some of the warning signs and how best to protect yourself from ever having a stroke. Dr. Levy, thank you very much for coming in today.
Good morning, Doug.
Stroke is a really troublesome thing in the sense that people who have it oftentimes are permanently disabled, and recovery is long, arduous, disappointing, demoralizing to people, all these kinds of things.
Strokes can be terrible things, not only for the patient, but for the patient's family as well. But as we mentioned just a minute ago, the symptoms of stroke are, and I want to go through those a little bit, some of the warning signs,
Sure.
and how people can recognize the symptoms of stroke. But it can leave patients with neurologic deficits or impairment that goes from the very subtle, like a personality change, to something that's very devastating, of being paralyzed on a half of the body, not being able to speak, not being able to swallow, and that's difficult not just for the patient, but for the family and all the support givers around them.
Tremendous effort and tremendous money to care for people like that.
Exactly. But, you know, the real effort has to be in education and trying to reduce the risk factors that lead to strokes. And stroke is the third leading cause of death in the United States. Heart disease is the first. And about 800,000 Americans will have a stroke this year, and of that number, 150,000 will die.
Amazing. Let's talk about the basic warning signs of a stroke. What are they?
Sure. The warning signs of a stroke that everyone needs to be aware of, and there's an acronym that we try to put out there called FAST. All right, F is for face, so that if there's some facial asymmetry, if one side of the face is drooping, or if you see someone, you ask them to smile and see if the face goes up symmetrically. If it doesn't, that's a problem. A is for arms.
Would this be something that the wearer of that face would be conscious of?
They may not be conscious of it. They may not be aware of it. Of course, it would depend. If they're having trouble with speech, forming words, they'd probably be aware of that. Sometimes they may just find they're drooling and they don't realize it, and it's because they're having trouble with the muscles on that side of the tongue or the face. The A in FAST is for arms, and you're looking for weakness in one arm compared to the other, or see if they can hold up both arms and if one droops. The S is for speech. Is there a problem with speech? Are they having trouble forming words, moving their tongue, understanding words, as well as finding the words to use? And the T is for time, because time is really the critical issue here. If we're going to treat patients who are having strokes, they need to get to the hospital very quickly, because we only have a few hours in which we can treat them with some of these newer medications or some of the blood clot dissolving medications that can be effective in treating strokes. It's a little different than heart attacks, which we talked about last time, in which we have a little bit more time, but the brain cells die much faster than heart cells. And what causes a stroke is that the blood supply to part of the brain is interrupted, usually by a clot, just like what causes a heart attack, and we need to try to restore that blood flow as quickly as possible.
So it really is almost like a heart attack of the brain.
It's exactly a heart attack of the brain. It's you're interrupting the blood supply to part of the brain, and those brain cells start dying.
These symptoms which you talk about, the fast components of it, a quick onset, or can it be a slow onset?
Usually it's a sudden onset. It goes from no deficit to a sudden deficit, and that's when the blood supply is cut off. And most people will know it, although sometimes you can have very subtle findings, like some visual findings, maybe a little bit of clumsiness. You're having trouble picking things up, or your balance is off a little bit. If you have any of those signs or symptoms, you need to seek medical attention immediately.
Now, I've had in the past migraine headaches. Luckily, I don't get them anymore, but I hear from people who do get them, and I remember this experience of having that sort of weakness of vision in certain quadrants, maybe a little bit of confusion, or asking people to repeat themselves, probably very similar to a stroke. What's the difference between a migraine headache and those symptoms and a stroke?
Well, a migraine headache, and depending on which kind of migraine, there are migraines that have auras. You have a warning before it's coming, and migraines that don't have auras. But that's also a vascular event. It's due to expansion and contraction of blood vessels in your head, which is altering the blood supply to your brain. Fortunately, it's not cutting off the blood supply, and it's not causing damage, but it's causing a change in blood flow to the brain that causes that.
But do you have
headache.
people who mistake a migraine headache for a stroke?
Well, I should mention that's a very good point, Doug, because one of the other warning signs, and I went through fast, and I'll get back to your question, is the worst headache of your life. Okay, that is another symptom that you should not ignore, because that can mean that there's bleeding in your brain, and that's another cause of stroke, a much smaller cause of stroke, about 15% of strokes. But if you have the worst headache of your life, and with Beau Biden recently being hospitalized with a small stroke, the stories about his dad's hemorrhage from an aneurysm came back up, and the vice president has described it as the worst possible headache of his life, and all he wanted to do was curl up in a ball. And if you have something like that, you need to seek medical attention immediately.
Beau Biden, not an old man, a young guy. How common is it among young people?
41 years old. Interestingly, about 15% of strokes will occur in individuals under 45 years of age. The vast majority occur in folks over 65. And usually the strokes in younger folks are for different reasons. The risk factors that I think we should probably touch upon for folks out there to be aware of, because the important message here is what you can do to reduce your risk. The major risk factors for stroke are similar to heart disease, but much more significantly weighed towards cigarette smoking and high blood pressure. Two things that we can obviously do something about. There is a heart rhythm abnormality called atrial fibrillation, which needs to be managed closely by your doctor because it requires usually anticoagulation. That is a significant risk of stroke. And those are the three big ones. The others, which are the general risk factors for all vascular disease, which is family history, which you can't do anything about, cholesterol, which we talked about, know your numbers, know what your cholesterol is, make sure that it's under control, diabetes, obesity, sedentary lifestyle. They all play a role, but cigarette smoking, hypertension, and atrial fibrillation are the big three.
And these are all things that we can take precautions against. Just watch it.
Absolutely. If we could eliminate cigarette smoking and control everybody's blood pressure, we'd save hundreds of thousands of lives a year.
One last question before we go. We have time for this. An aneurysm in the brain, is there basically causes the same effect as a stroke, correct?
Depending on where it bleeds, yes, it can, because what happens is that's a weakening in the wall of one of the arteries, and if it leaks and blood gets out into the brain tissue, that causes damage, and it will lead to certain deficits. If it really just bleeds, usually the patient will die immediately.
Any way to find out whether or not you have an aneurysm or a weakened blood vessel that would cause something like that?
Not really. It doesn't make sense on a population-wide basis to screen everybody with head CTs, but again, if you're having any kind of funny neurologic symptoms, weakness, confusion, speech problems, terrible headache, balance problems, you need to seek medical attention immediately.
Dr. Warren Levy, thank you so much for enlightening us. We really appreciate that. Good to see you.